Hi everybody, my name is Frances Milligan. I'm a licensed marriage and family therapist and I'm the program director and co-founder here at Lido Wellness Center.
My name is Tayler Deamon. I'm also a licensed marriage and family therapist, and I am one of the primary therapists here at Lido Wellness Center.
I want to spend a few minutes talking about PTSD and what some common symptoms that people might experience when they're struggling with PTSD related symptoms. So PTSD in general is a mental health diagnosis that really stems from experiencing either an event or a chronic set of situations that one experiences as dangerous, as unsafe, as tumultuous, and it's our body's response in that experience of either getting stuck in a fight or flight or freeze response, or in an experience of kind of reliving some of the symptoms or some of the experiences that we may have experienced. Some common symptoms is intrusive memories or memories of the event or set of experiences that one might have had. It could also be more physical related symptoms like tightness in your chest or shortness of breath or racing thoughts or things that sometimes show up a lot like anxiety. And it can also be seen as more impulsivity or kind of reckless behavior at times as well.
I think too, a lot of what we see when we see someone who's experiencing symptoms of PTSD are a lot of avoidance behaviors, avoiding situations that might remind us of the event or situations that caused our PTSD, or avoiding situations that might bring up some of those anxiety symptoms that Frances was mentioning. So describing PTSD in the scope of mental health is something that I really see as all of it really goes hand in hand. Mental health in general and experiencing something traumatic can lead us to not only having PTSD symptoms, but also experiencing increased symptoms of maybe depression or anxiety, or just a general experience of our functioning being impaired and having a hard time in our life.
And kind of in line with that, a lot of times when we experience trauma of some variety, it will increase our experience or maybe start a new experience of some of the other mental health related symptoms. And that said, there is times in which somebody can experience PTSD without any other co-occurring mental health related symptoms, and vice versa. So they tend to work hand in hand, and it's not mutually exclusive. So PTSD, or post-traumatic stress disorder, can be caused by a variety of different situations. It could be a result of a more kind of event-driven situation, like a violent experience, or very like a car accident, or an interpersonal kind of violent situation. It can also be caused from more kind of chronic long-term experiences like childhood abuse or neglect, or things along those lines. And it can also be something that at large we can experience in a different sense as like a whole culturally, or in a community where we all experience some kind of devastating event like 9/11 or things along those lines.
And I think that is something that has really become much more common with everything that's gone on in the last year with COVID. Even if people haven't experienced a direct trauma like losing a loved one, as a culture we've really experienced this kind of traumatic year, and it's been prolonged. So we're seeing a lot more people suffering with symptoms of post-traumatic stress disorder related to those kinds of things.
Mm-hmm.
Here at Lido Wellness Center, we treat PTSD in a variety of ways. It depends on the needs of the individual person and what they're experiencing. We have groups related to helping teach coping skills, to address the PTSD symptoms that people might be having come up in their lives. And then we also have some more specialized treatments in individual therapy, such as our EMDR, which is eye movement desensitization and reprocessing. We also do some somatic experiencing, which Frances might know a little bit more about.
Yeah, so like Tayler was saying, we have kind of a variety of different individualized services that we can offer somebody coming to treatment with us. EMDR is definitely a very well-known and well-studied modality. We also work very heavily with somatic experiencing, and really that looks at more of, instead of the reprocessing of trauma, it looks more at body integration and how we can get our nervous system into a place where there's some more kind of flow, and there's less stuckness when it comes to our experience internally. And it really looks at more movement-based and body-based type modalities and movements. In line with that, we also have a number of other group modalities that are also very kind of more somatic or body-based, like trauma-informed yoga, dance movement therapy, as well as like art therapy and music therapy, which really help get us out of our thinking brain and into more of our somatic or kind of hands-on tactile place. For anybody interested in coming to treatment, I would say first and foremost, it's a huge decision, and to kind of provide some empathy and congratulations around making that choice, because it's something that often is a difficult thing to kind of mull over. Secondly, I would say that there's hope that we are able to, as a mental health field, we are able to provide support and understanding and relief and symptom reduction to both the mental health side of things, as far as depression, anxiety, things like that, as well as PTSD and trauma-related symptoms. And more than anything, for me, that's what I love about what we do, is that we're able to see growth and change and relief, and people kind of getting back to a normal place for them, so that they can kind of get on and continue with their life instead of being stuck.
Frances said it really wonderfully. The only other thing that I think I would add is that we really invite, people who might be feeling nervous about coming to treatment, and we want to help provide the most healing and welcoming space that we can, because we know that it can be intimidating and kind of scary to take a step into working on this. But as Frances was saying, there is hope, and it's a really wonderful experience to be able to see the relief that people can have